Welcome to room 428. For those of you who remember, this is the old document room, but given the construction and the beautiful restoration, this is a beautiful room that we're now able to enjoy and be able to have events like this. And today is a wonderful day in terms of progress when it comes to healthcare policy. We in the Massachusetts Senate have gone through a very extensive process to develop legislation aimed at enhancing our healthcare delivery system here in Massachusetts, set around certain goals that we set out and determined over a year and a half ago with the Senate President, under the Senate President's leadership, and working in collaboration with the Milbank Memorial Fund. We've been able to work together, come up with set priorities, and really develop a really strong piece of legislation that's based on common sense, that's based on realistic expectations, and at the same time is really consumer-driven and understanding that whatever changes that we make, we want to make sure that they have a positive impact on the market. With that said, as I said, under the leadership of Senate President Rosenberg, this all started about a year and a half ago. And I'm going to turn it over to Senate President Rosenberg now, who's going to talk a little bit about this process and take us over to the next step.
Great. Well, thank you very much. And I want to thank all of the participants, not only the members of the Senate who were in the working group, but also folks in the administration, folks over at Health Policy Council and CHIA, and a wide range of people inside the government, as well as people on the outside of the government. And you will see in the report that there are a lot of organizations and names listed, so we're not going to do that at this microphone, but suffice it to say that over the year and a half, we got a significant amount of input both from other states, as recommended by the Milbank Fund, where there were some best practices being implemented in areas that we wanted to focus on here in Massachusetts, cost centers where we felt we could be doing a better job, and looking for some guidance and help by helping to find best practices in other states, but then also to look to our own neighbors here, right here in the Commonwealth. And those roundtables that were conducted in August were extremely fruitful. And we had, frankly, some days we had as many people watching the discussion as participating at the table. And believe me, after the discussion, we heard from many of those people who were not at the table to offer their ideas. So there was an opportunity for anyone who wanted to weigh in during this process to do so. And our objective in starting this project with the help of the Milbank Memorial Fund was to follow on the model that we developed as a result of working with them on marijuana. And they were kind enough to work with us to help senators travel to other states and do research virtually in some other states so that we could come up with a report to help guide and influence the discussion around recreational marijuana, which was going to be on the ballot. And that project went so well that the Milbank Memorial Fund worked with us, and we came up with a second project, and they graciously and generously supported the research and the effort that's being unveiled today. I would say that the major thrusts were to try to guarantee access, maintain or improve quality, bring down cost, and maintain or improve outcomes. And I think the collection of proposals in this report and the bill fit within all of those criteria. And I'm going to leave it to others to describe the specific initiatives, but I do want to highlight one myself because it's an initiative that I've been working on for a number of years, following on the good work of Senator Mark Montigny, who some 20 years ago was trying to work on bringing down pharmaceutical costs through aggregation. And there were efforts made in the state and efforts made on a regional basis in New England, which produced some results, but we knew that we needed to do more. And so this bill, I'm very happy to report, builds on the work that he did those many years later, and on some legislation that he and others filed that related to transparency and providing additional information with the objective of helping us to understand more about how the industry operates, what are their cost centers, how do they develop new products, how do they get priced, and how do we ensure that we guarantee access to people. And I'm very proud of the work that was done with the help of the pharmaceutical industry leaders in Massachusetts during this process, and with Blue Cross Blue Shield and others as they came together and crafted some very specific proposals that I think are unique to Massachusetts. And I'm going to not go into detail at this point. It's in the report, and others may speak to it today, but I'm particularly proud that we are working together to make sure that this important industry here in Massachusetts is working with us hand in glove to try to address the crushing costs for so many people of having the pharmaceuticals, access to pharmaceuticals that they need to improve the quality of their lives and, in many cases, to save their lives. So I want to thank everybody again who participated in this process, and thank Jim Welch, who was, as chair of the committee, was the chair and the leader of this effort, and Senator Chandler, who had previously served as healthcare chair in the House, and as our majority leader has been extremely active, continuing to help guide us in the area of healthcare, and the other senators who are gathered up here today who helped with this effort. So thank you all very, very much. We look forward to working with everyone to continue to improve this bill and to get a significant bill to the governor's desk. And I should comment that we promised the governor we would give fair consideration to the proposals that he filed in June. There was not enough time to process them, the transparency and the engagement that was necessary, so we did not include them in the budget. But we promised him we would give fair consideration to them, and you will find that several of the provisions are actually contained within our recommendations, as are a few things from the Price Variation Commission, which worked so hard over roughly a 8 or 12-month period to come up with some ideas. So there's plenty of room for creativity and for partners in the House, Senate, executive, and all parts of the private sector, for-profit and not-for-profit, that are engaged in our largest industry in the Commonwealth of Massachusetts, healthcare.
Who would have known a year and a half ago that healthcare would be this important? We knew it was going to be important, but who would have known this important, and who would have known it was so complicated? Thank you. I couldn't help that. I'm sorry. And thank you, Senator Welch. You have provided such vital leadership as chair of this working group, and it is reflected in today's report and the recommended legislation. Thank you. And I want to thank all the other members of the working group for their hard work, insight, and commitment to our charge. We have also been collectively working with stakeholders from around the country, as you heard, and around the state as well, on the issues of healthcare access, cost containment, and coordination of care. This has only become more pressing as we see the effects of short-sighted federal changes, most recently in the halting of cost-sharing reductions to assist individuals covered through the connector. We will continue to monitor the situation as it develops and see how we can ensure coverage for all citizens of Massachusetts. Over the past year, we have heard loud and clear that the rising cost of health care is simply unsustainable. It grows faster than our paychecks, our businesses, and our economy. The strain it places on our state budget is similarly unsustainable. Rising health care costs are crowding out our shared priorities. As a result, the working group has been looking at changes to Mass Health that encourage savings and efficiency throughout the program. As we have seen time and time again, challenges in the commercial market compound the challenges that we face with Mass Health. When our residents and employers cannot pay the unaffordable premium increases of the private market, they rely upon Mass Health instead. Our efforts over this past year have led us to identify ways in which the Commonwealth can do more to reduce health care costs for families, for businesses and for the state budget, while improving health outcomes for all. Based in part on numbers received from the governor this summer associated with his savings package, mass health reforms enabled by this bill include $114 million in savings for 2020. I repeat, we estimate $114 million in savings for 2020. We implement the HERD form. We increase tools for behavioral health parity and reduce the costs of Mass Health Children's Behavioral Health Initiative. We identify opportunities for further efficiency within Mass Health and ways to support the implementation of Mass Health ACO program. We have also kept savings opportunities for individuals and businesses at the top of our minds. We expect to see a total savings in the commercial private in 2020 of up to between $475 million to $525 million. And I repeat that, in the year 2020, we estimate $475 million to $525 million in savings associated with the initiatives in this bill. For example, curbing pharmaceutical costs, reducing hospital admissions, and slowing the growth of hospital spending. These savings will translate into slower premium increases and other consumer savings. While these savings are important and they're a piece of the bill, as you can tell, there is so much more to this bill. For example, we look at creative, innovative solutions to long-standing challenges that we have encountered in healthcare, such as behavioral health. We have established a new licensure for behavioral health urgent care, which may someday serve communities in the same way that the family resource centers across the state do. I would also take an opportunity to end by once again thanking the stakeholders who have spent countless hours giving us ideas, guidance, and advice. And I continue with this release. I continue to look forward to working with all of you. Thank you.
Next up, a little change, but we're going to have Tyreek Hill from 1199 SEIU come up and make a brief statement.
That's okay. You can change my name.
Sorry.
That's
you know
all
who
right.
that is, right?
Tyreek Hill?
Yeah.
You can tell me later. Good afternoon, everyone. My name is Tyreek Lee, a.k.a. Tyreek Hill. I work for 1199 SEIU, United Healthcare Workers East. We have 56,000 healthcare workers in the state. They work in healthcare, and they also get their care. And I want to thank the Senate President and the whole team for moving us forward in this discussion. You know, my predecessor, Veronica Turner, taught me that change starts with a conversation. And in Massachusetts, we know how to continue these conversations, and we know that what happens in D.C. is not something that's far away. And so by filing this bill, you know, the devil's in the details. We're going to review it, but together with our Senate President, with our governor, and our speaker, and the stakeholders, as mentioned, and the healthcare providers, we will continue to bring Massachusetts to the next step. Together we have, together we will, and together we'll rise. So thank you all for being here today. We got a lot of work to do, but I want to really thank you all for getting us to the next step. Thank you.
Tyreek Hill is the wide receiver on my fantasy football team, so just so anybody. Yeah, I'm not. He did all right. He did all right. He's hot and cold. So, but next up, you know, it's been an absolute joy, and it's been a great experience in my career to get to know the next speaker and really be able to learn from the next presenter, Senator Harriet Chandler, the Majority Leader. And throughout this whole process, you know, as you're putting pieces together, as you're putting, you know, pen to paper, as you're floating ideas out there, as some people say, oh, you can't do that, you can't do this, or you should do that, you should do that. Sometimes things get to you a little bit, right? But there's always a calming person that's part of the group that helps you remember and stay focused. And you know, not only are her ideas and her leadership, but her calming presence, at least on me, certainly have been very beneficial, and I appreciate that. And it's really a real sign of what a true leader is. So without further ado.
Thank you. Thank you. And thank you all for joining us today. Whether you pay out of pocket, whether you are on the exchange, whether your employer has given you the most comprehensive benefit package for you and your family, someone is still footing the bills, and those bills have become excessively high. With this report and legislation, the Massachusetts Senate is putting forth a plan for new leadership in healthcare policy. These strategies and policies have been long researched and extensively scrutinized. And importantly, once again, Massachusetts can work as an example for the rest of the nation. We're pursuing innovative strategies to ensure that quality care comes to you, and telemedicine is one innovation that we intend to promote and improve. We are long late to the table, but we are there now, hopefully. The use of telecommunications to diagnose, consult, and treat patients reduces the distance between you and your doctor from miles to the mere inches between your face and the phone. Telemedicine can increase access to services for behavioral health and reduce overutilization of the system. With our legislation, we will increase access to telemedicine by expanding health insurance and Medicaid coverage to those services. We want to ensure that reimbursement for a telemedicine service is determined in the same way as a reimbursement for an in-person visit service. From the science fiction in my childhood to reality right now, the Massachusetts Senate is creating the framework for the future of how we deliver health care. I've said it once and I'll say it again, a healthy body begins in the mouth. Dental health is just as important as any other health care pursuit. But so many people in this state lack access to this service. And our solution is to create a new dental service provider called a dental therapist. A dental therapist can perform many of the same emergency dental procedures as a dentist, but they will go where a dentist will not. In other states who have adopted these therapists, dental therapists have worked in nursing homes, in schools, and with rural populations to provide services that were previously absent, yet always necessary. These therapists work with dental practices, educated in dental schools, supervised directly for 2 years, then dispatched to practice across underserved communities. With dental therapists, dental health services are delivered directly to those in the most need. That's the right care, in the right place, for a fair price. That is innovation. Thank you.
As some of you know, I'm pretty passionate about issues of public health and population health. So I'm going to start with one of my favorite quotes from Ben Franklin, who famously said, "An ounce of prevention is worth a pound of cure." This legislation, I believe, really takes these words to heart with a strong focus on population health and addressing the social determinants of health. By doing so, we can both improve health outcomes for the residents of the Commonwealth, and we can better control healthcare costs. So that's a win-win. According to the Blue Cross Foundation, about 20% of our health is determined by our genetics. And of course, there's not a lot we can do about that. Another 20% of our health is determined by the health care that we receive, which is why, of course, our healthcare system is so important to all of us. But the remaining 60% is determined by social, environmental, and behavioral factors. In other words, the social determinants of health are absolutely critical in determining health outcomes and health disparities. Take, for example, the growing epidemic of diabetes in our state and around our nation. Since 1990, the percentage of Massachusetts residents living with diabetes has risen from 3.8% to almost 9% today. According to the American Diabetes Association, the medical cost of treating a person with diabetes is 2 to 3 times greater than for somebody who doesn't suffer from the disease. And it's estimated in Massachusetts we spend more than $3 billion each year in direct medical costs to treat diabetes, and there's also an indirect cost of about $1 billion in lost productivity. And type 2 diabetes is largely preventable for most people. This bill takes a number of important steps to further our efforts around prevention and wellness and to address the social determinants of health. Let me just mention a few quickly. First, it reauthorizes and updates the successful Prevention and Wellness Trust Fund, and it provides opportunities for new sources of funding for the PWTF. Second, it expands access to basic preventative health services, including physical health with new opportunities for nurse practitioners and others, for behavioral health, which you'll hear more about as we continue, and for oral health, as you just heard a moment ago from Senator Chandler. Third, it establishes regional planning councils within the existing Health Planning Council, which is charged with assessing the current healthcare needs across the Commonwealth. These regional councils will be identifying innovations and best practices in healthcare within each region of the state, identifying interventions that improve population health at the regional and community level, and facilitating implementation of these innovations and best practices throughout each region. And fourth, this bill establishes a new healthcare trailblazer designation for the purposes of recognizing organizations for their innovative practices that can then be scaled up and translated to other organizations working around the state to increase their impact on our healthcare system and on population health. Thank you all very much, and we look forward to continuing our work together on this very important legislation.
Senator Welch talked about behavioral health, and when it comes to behavioral health, there really isn't a right time, and we really struggle with what is the right place for appropriate behavioral health care. And we're not sure exactly what's the right place, but we know one place that's not appropriate, that's not the right place, and that's the emergency department. And this legislation, it goes a long way toward addressing the emergency department issue. The appearance of people with behavioral health problems at the emergency department, where they may be stabilized and then oftentimes left to board while an appropriate setting and appropriate placement is found for them. So this bill, in 5 ways, addresses that and other behavioral health issues. One, it establishes behavioral health urgent care centers, or sets up a process for behavioral health urgent care centers. Again, places where people with urgent behavioral health needs will be able to go, rather than go to an emergency department and once cleared medically sit in the emergency department, they will be able to go to a behavioral health urgent care center and know that they're going to receive the appropriate care, the right time, and in the right place. Also, it will provide for the better coordination between MassPat, which is our prescription monitoring program, and electronic health records. That's critical, that when people do end up in the emergency department, or they do end up at an urgent care facility, that the treating physician is aware of that patient's entire medical history, and particularly when it comes to certain prescription medications. They will be better able to provide care to that patient. Readmissions reduction benchmarks will be established. There are a whole host of reasons why people are readmitted to hospitals, and particularly through the emergency department, but we know that those with behavioral health are a significant driver of that readmission. They may go to an emergency department, be stabilized medically, referred out, and if it's not the appropriate referral out, if it's not the appropriate placement, we know that they're going to show back into the emergency department and then be subject again to that process of boarding. So this readmissions benchmark, the reduction of readmissions, is a worthy goal, and we think it will have a significant impact on readmissions for those with behavioral health issues. Mobile integrated health, another area that is particularly beneficial to those with behavioral health issues. To have a first responder in a community able to, when they arrive at a scene, use training to assess the situation, but know also that they have the ability through telemedicine and through integrated health to access resources and expertise that will allow them to better handle the situation on the ground, and to make a decision with that help to send that person, or take that person who is in an acute situation to the appropriate place for treatment. Again, right time, right place is absolutely essential. And then lastly, there will be a certification of providers to make sure that for adolescents, those under the age of 21, that the appropriate services are being provided. there will be a certification of that on an annual basis, and that's a critical step towards achieving parity for those with behavioral health, those between behavioral health and those with medical health issues. So those are 5 ways in which this legislation really protects, promotes, and helps those who struggle with behavioral health issues. And we're committed to make sure that as this bill moves forward, it provides those key elements, and that as we pass this legislation and move forward, that doesn't mean the end of our efforts, but that we're going to continue on.
Before we move on to the next portion of our, and it won't be too much longer, but I do want to take some time. Obviously, we as elected officials do spend time in front of the cameras and do spend time in front of making the presentations, but to bring it all together, it really takes some high-quality people with a lot of knowledge and a great working attitude, and we are very fortunate here in Massachusetts. Being a leader in healthcare, we're able to, as we've heard through this process, be able to recruit the best doctors, to be able to recruit or have the best healthcare facilities in the world. Well, it also means that we have the best healthcare policy experts in the world, and there's a group of people that work very hard on this legislation. I just want to mention them, quickly here. They do deserve a lot of praise for the work trying to corral all of us, holding many meetings time after time, oftentimes with the same individuals or the same groups, so their patience is always something that we can stress as well. But Will from Ways and Means, Mike Cannella from my staff, Martha from Ways and Means, Anna from the Senate President's Office, I see Pete from the Senate President's Office, my Chief of Staff, Lauren, who's only been here for 5 days, but you know what, you get some credit. So I would have to say Liz Toner. There are any Brian Barash, I think, from Senator Chandler's office. Anybody I forget from here? No? Mark Daly, of course. Yep, Mark Daly. I'm sorry. And AJ from Senator Keenan's office. Again, best and the brightest. We can't overlook the talent that we have here in Massachusetts, and a lot of thanks, believe me, goes out to that group. So now we're going to bring up some people who want to say some very nice things about this legislation. First up, I'd like to bring up health care for all.
As Senator Spilka said, this is a really critical time for health care. Healthcare is constantly under attack on the federal level. Patients, providers, healthcare systems, insurers don't know what to expect from day to day. But here in Massachusetts, we've made great strides in terms of access and coverage. And now more than ever, we need to have Massachusetts as a leader to continue to think about ways that we can improve our system and the care that people receive. At Healthcare for All, we have a helpline. We get about 20,000 calls every single year from people all over the state. And we hear about the high costs of healthcare and that healthcare is too expensive. Premiums, co-pays, deductibles are too high. Prescription drug costs are too high. We also hear that the healthcare system just doesn't work as well as it could. It's hard to get dental care. People are discharged from the hospital, and then too often they're readmitted right back. Doctors prescribe medication based on the advice of a sales representative. And we focus so much on curing people once they're sick and not focus enough on preventing them and keeping them healthy. So what we really need to do is understand the unknown prices of drugs and stop the surprise medical bills. We need to provide doctors with unbiased information about medicines and get more information into patients' hands about long-term services and support options. We need to cut hospital readmissions that are so expensive and expand low-cost preventive care. And we need to get people the oral health care that they need and get them out of emergency departments when that's not where they should be. This piece of legislation makes great strides towards accomplishing all of these things. We thank the senators and the staff and everyone who's worked so hard to make this a reality. And we are looking forward to Healthcare for All digging into the details and analyzing this piece of legislation so that we can help improve the system for everyone. Thank you.
And through this process, as you kind of try and develop policies and try and develop, I guess, courses of action to try and do the right thing. You encounter groups and organizations and people that are willing to engage with you on a day in and day out basis, people that are willing to say, okay, well, this may not work, or this is something that we think could work better this way, but aren't always just there to say no. They're there to help in the process, and they're really invested in the process. And I can say that this group is a shining example of the type of people that we've dealt with through this process, that were willing to engage with us and willing to help us find the right balance in this legislation.
Every year, it seems, I've been invited to be a witness at the annual health policy cost trends hearings, and every year I say the same thing. Hospitals like Lawrence General, and all of my colleagues here, are a critical part of the solution for the rising unsustainable health care costs in Massachusetts. We've already figured out how to offer incredible clinical capabilities, access to care locally, high-quality care, and we are extraordinarily efficient because of necessity, because we are among the lowest paid hospitals in the Commonwealth. We're also one of the busiest providers of the emergency care throughout the Commonwealth, with 75,000 ED visits per year. We provide very highly advanced surgical care in our state-of-the-art surgical center and provide access to a large underserved population. We're keeping care local more often at a lower cost, but we are still fifth from the bottom in terms of reimbursement for our services. Market forces are not working to fix this unwarranted rate variation. The Senate's health care bill unveiled today provides a path for remedy. It needs to go further, but the Senate in this bill has staked out a position that where we would not be paid less than 90% of the average relative price, because there is no reason that care and procedures that we provide at Lawrence General, with the same equipment, the same credentialed caregivers and physicians, and the very same quality and outcome, should be paid 1/4 of what another community provider is paid. Again, I want to thank the thoughtful, collaborative approach of the Senate and the Senate President, Stan Rosenberg's leadership, and of Healthcare Finance Chair Jim Welsh. This bill is critical to the health and sustainability of many high-value and high-quality hospitals and the communities they serve. We look forward to working with you to make this bill a success.